It's the news no one ever wants to receive.
Pediatric cancer diagnosis really impacts the entire family, of course, the patient, but also siblings, parents.
And it's increasingly coming with a price tag very few can afford to pay.
A lot of families, they want to do everything they can, of course, to help their child. And sometimes that means quitting a job so they can take their child to treatment, so they could be there with the child in the hospital, and not all families can do that.
Kate Tillotson is the CEO of Bare Necessities, a nonprofit pediatric cancer foundation that works to support families while searching for cures.
With all of the costs that are involved, we try to offset that by providing, support for transportation costs, utility bills, things like that.
According to a 2021 survey, 61% of cancer patients and survivors find it somewhat or very difficult to afford their care. And over 80% of patients said they've had to make financial sacrifices to cover their healthcare expenses. To put those percentages into perspective, consider the fact that the American Cancer Society estimates that more than 1.9 million new cases of cancer will be diagnosed in the U.S. in 2023. So, what exactly is causing this financial hardship for cancer patients? Well, like just about every other medical ailment these days, skyrocketing drug prices. Dr. Hagop Kantarjian is an oncology specialist at the University of Texas MD Anderson Cancer Center, and for the better part of a decade, he's been calling out what he says are exorbitant drug prices.
After we did all these editorials and pleas, over the years, nothing has happened.
Today, the average annual cost of a new cancer drug in the U.S. can reportedly run around $283,000.
So in 2013, the average cancer drug price was anywhere from $100,000 to $120,000 a year. Before 2000, it was probably around $10,000 a year. Today, the average cancer drug price is over $200,000. In 2022, it was $222,000 per year.
This has forced an increasing number of patients to make some gut-wrenching decisions, everything from rationing out medication to even skipping treatment altogether.
Patients with cancer are having, because of the high drug prices, sometimes to make a choice between life and death based on the cost efficacy.
And the U.S. is predominantly alone in having this problem. According to a 2019 study, median cancer drug prices in Europe were 52% lower than U.S. prices. And Dr. Kantarjian says in some cases, the drugs can cost as much as 300% more.
Financial toxicity is very real. There are many people facing cancer or being treated for cancer who have to mortgage their homes, lose their homes, go into bankruptcy, and that's a tragedy. And we need leadership, particularly from government, to change that.
Andrew Shore is a medical journalist and living with two types of cancer.
To just give you an idea, I take 4 pills a night for a condition I have called myelofibrosis, and I think the retail cost of those pills is $16,000 a month. I also get an infusion to improve my immune system for the leukemia I have, and that's about another $8,000. And then to boost my energy, there's another shot I get every 3 weeks, and I think that's about $8,000 or $10,000 every 3 weeks.
While a good deal of his regimen is covered by Medicare, he knows many people still struggle with copays.
You need caps on the yearly out-of-pocket cost, and you need to reduce the cost.
As a journalist turned advocate, Shore has spent more than 30 years helping other cancer patients try to make sense of their diagnosis.
I was one of the first, with a few others, as patients to go to medical conventions and cover it as a patient journalist, if you will, not for doctors so they could be informed if they didn't get to go to the medical convention, but for patients who were living with the conditions that were discussed.
And that starts with reading up and asking questions.
When you're told you have a cancer diagnosis, I think it's really imperative that you, your loved ones, your support team, if you will, care partners, get smart. It's very important to include in your options, is there a clinical trial? They may be developing tomorrow's medicine today that I can get, and where the drug in the clinical trial will be provided for free. Not all of the treatment, but maybe the key drug.
Meg Hilling, Scripps News, Chicago.